Hello, I'm Dr. Chad Spillers from Aspenridge Chiropractic Center. We provide chiropractic care, acupuncture, customized orthotics, and physical rehab. Today I want to talk to you a little bit about a condition that I see very frequently that concerns the sacroiliac joint or the SI joint. It can be a very painful problem for people. Typically what I see is that the pelvic bone here, the iliac, where it meets the sacrum, that joint becomes inflamed. I see that the pelvic joint tips back and becomes fixated quite a bit. Some of the symptoms that I see with that are sharp, stabbing pain right in that joint. You can have a referral pattern of pain that goes down the leg, usually not below the knee, but sometimes into the calf and into the lower leg. You can have pain that wraps around into the groin, or a pain that wraps around into the front of the leg. Typically with that, it's very superficial, just under the skin, that kind of pain. But what I see with people is that it'll be like kind of like their leg will give out on them, so they'll take a step and it'll be like they just want to drop to the ground at times. So it can be very intense. I tell people to use ice, not heat, when there's an inflammation like that. So what I do for that, I use several different techniques. Typically we do a therapeutic soft tissue therapy, either interferential typically, that's an electromuscle stimulation, or we put them on what's called a intersegmental traction table, where the table, it kind of massages both sides of the spine, and then as it goes over each individual joint, it kind of tractions the joint. Then we move to the adjusting. This table here was designed so that the back part of the table breaks away, and we go up and down, and we can go side to side to bring that joint through its normal range of motion. There's another technique that I use. It's a drop table technique where the table pops up. We use gravity to help with the adjustment. It's kind of loud, but it's a very low force adjustment, and it just gets the joints moving again in a normal range of motion, so that the function of the joint is much better. So that's how we approach that. Once we get it under control, we talk about stretching and strengthening exercises. Everybody who comes in the front door here gets homework. It's very simple, easy to do for the most part. And the people who are very involved in their care do much better than the people who aren't. So, again, I'm Dr. Chad from Aspenridge Chiropractic Center, and that's SI problems, sacroiliac. Thanks. We'll see you next time.